The following audio-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak to a healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast.
What's up, Cheat Codes listeners? It's me, Dr. Z.
And me, Dr. C.
Dr. C, we've got another one. We've got a rising star.
These are some of my favorite episodes.
I feel like, we were just talking about this. We're live from Stowe, Vermont. And one of the beautiful things about this meeting, for me at least, has been there's a lot of familiar faces, but there's a lot of new ones.
Yeah, it's good to see. It's a growing field.
It's a growing field. There's a lot of superstars, as many stars in this audience at NASAC as there are in the sky in Stowe that we saw last night.
And there are a lot.
Yeah, so Dr. Azar is not a stranger to you and I. And certainly not a stranger to the Boston sickle cell community. Dr. Sharl Azar is he's on a rocket, man. He's changing the community. He's changing the way people get care in sickle cell disease.
Yeah, you and I had a chance to catch up with him, I don't know, a year back maybe.
That's right.
And I was amazed to hear all the stuff he's working on. I can't wait to hear the updates.
Dr. Azar, welcome to Cheat Codes.
Thank you so much for having me. It's great to be with you guys.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, partners, and each other. Building on these connections and the company's unmatched leadership in PK activation, Agios is pioneering therapies for rare blood disorders, including PK deficiency, thalassemia, and sickle cell disease. To learn more, visit us at agios.com. That's AGIOS.com. To join the conversation with other patient allies, follow us on Instagram at Ally Voices Rising. That's Ally, ALLY, Voices Rising.
Man, you are just up to so much incredible work that for us, it was an obvious choice when we were thinking about this Rising Stars episode on who we wanted to highlight. You were the first name that came to mind. And, the questions are going to be easy for you because you're an expert in yourself.
Okay, I'll try. Good, that's good.
Where does the story of Dr. Sharl Azar start?
Well, it's very kind. I mean, it's wonderful to be with you guys, and I really appreciate you guys having me. I don't know if I deserve this rising star title in any way, shape, or form. I think the rising stars are, of course, the amazing patients that we get the privilege of working with every day. I think so. I'm originally from the West Coast. I'm originally from Oregon. I was born and raised in Portland, Oregon. I am the child of immigrants. My mother's Lebanese, my dad's Syrian. They came to the States to give me a better life. I was born here in the U.S. and feel very lucky to have been, and got all of my medical training in Oregon. Went down to San Diego and did a second fellowship because I'm an idiot. And then I moved out to Boston, and I've been running the sickle cell program at Mass General.
Okay, well, that is a huge sort of summary. Now we're going to have to break that all down.
Great.
So at what point did Dr. Azar say, this is the path for me? I want to be a physician. When did that?
To be a physician, I had to thank my mom. So none of my parents are not doctors. No one in my family is a doctor. But my mother was super anxious. And so my mom would have me in and out of the doctor's office constantly. Yeah. So like my favorite drink growing up was that bubblegum flavored amoxicillin that we all got. Because I think I downed that stuff like it was going out of style. And I really I actually got this really great relationship with my pediatrician. And I thought to myself, that's what I would like to do. So that's what I thought. That's when I started thinking I wanted to go into medicine.
Oh, very cool. Very cool. I mean, that bubblegum flavored amoxicillin just took me back. Still some nostalgia there. Wow. So you had this kind of built into you. You decided maybe pediatrics. What is walk me through the process of discovering your passion for hematology.
Yeah. So, and I ended up as an adult provider, actually, because there was a day that I eventually came to realize I'm not great with kids. Yeah. So I'm going to leave kids to the people who really are passionate about taking care of kids and take care of adults. And so I What got me interested in hematology, so interestingly, when I went into my hemonc fellowship, I thought I was going to be an oncologist. I think like most hemonc trainees, they think they want to go into oncology. Cancer care is amazing. It's wide, it's rapidly changing. It's sexy. It's cool. And hematology always sort of gets short shrift. Throughout all of my training, it was sort of second fiddle. But I think it was actually when I met a sickle cell patient in the emergency room that I really came to realize that this is where I should shift my focus entirely.
And this was OHSU in Portland?
That's right. Yeah. So I was at OHSU in Portland where I did most of my training.
What was it about that encounter that was so compelling?
So I still remember this encounter like it was yesterday because I think it was such a seminal moment in my medical training. I was a first year medical student. I was brand new and we weren't even in our formal clerkships. These were just kind of observerships that we were doing as students. And I was in the ER and there was an attending who I was working with who I had enormous respect for. I was following him around for the day and we went in and we saw a young man with sickle cell disease who was in his early 20s. And I watched this provider that I had enormous respect for turn to this young man and say, "You need to go get your fix somewhere else."
Oh boy.
And it was, it was like, I'm sure it was more than a gut punch to the patient, but it was certainly felt that way to me just as an outside observer. And then what was even more remarkable was that that young man managed to gather all of his things and walk out of that room with his dignity intact, which sent me the message that this was not the first time that this guy had heard this message. And at that point, I sort of recognized that this is an area that we need to clearly do better in, and that I never looked back after that.
Oh, gave me goosebumps. Wow. It's interesting to me because it really does catch you off guard when you have these people who you respect as teachers.
Yeah.
And sometimes they let you down like that. So this idea, sort of the social aspect of sickle cell disease was planted in you quite early. You carry that with you. I mean, thankfully, I feel like part of our training, honestly, is learning from those who we want to be like, but also observing those who we never want to be like.
Absolutely.
That's an important lesson I feel like you got early on. As you continue through your sort of training, do you run into people who sort of show you the other side and show you what good looks like?
Oh, all the time. I think this is one of the most beautiful things about being at a meeting like NASAC, because I get to meet with my colleagues who are all equally as passionate as I am about the things that we care for on a day-to-day basis. Getting to meet with people like you guys, where we all have the same mission. And that reminds me, especially in the sickle cell world, where oftentimes we're the only provider at an institution or the only provider in our state, we can feel really alone. And we don't even have the data to be able to help us, to keep us company. And so it's always really nice when we get to have these meetings and we get to sit together with other colleagues and break bread with them and share stories together and recognize that we're not really alone in taking care of these patients.
Tell me a little bit about the sort of sickle cell training that you received in Portland. But then where did you go after you were in Portland?
Oof.
What was the next stop?
What sickle cell training is really the story. I was very lucky in Oregon. I worked with a pediatrician actually, because our sickle cell patients were largely cared for by an amazing pediatrician who is still very much in practice, who is joining the meeting remotely this time, but who I was lucky to be able to catch up with last year. She was amazing and wonderful, and I learned so much from her. I feel like the vast majority of what I've learned from sickle cell has actually come from the patients themselves, though. Our patients talk all the time about how they feel like they have to be the disease experts, that they show up in the ER and they're teaching the ER doctors how to take care of them,
right,
which is an awful burden for them to have to carry. But I tell my patients all the time that they're my best teachers. I've learned the most from them about how to manage this disease.
That's very true.
Yeah. I so many lessons from patients and caregivers.
Yeah. I mean, yeah, you're spot on. There's no comprehensive book or source of information, but every patient that walks through the door in clinic is an opportunity to learn about sickle cell disease.
Absolutely. I mean, we know, as you all know, like their lived experience outside the four walls of our hospital matters in so many ways far more than what we can do for them while they're in the clinic. Sadly, I don't have an armamentarium of treatment options to be able to offer.
Right.
And I feel like most of what we end up doing on a day-to-day basis isn't helping them to be able to live with this disease. And I learned so much from them about how to best do that.
That's beautiful. That's beautiful. So your journey takes you to metropolitan Boston,
Yes.
and you cause what I like to call a lot of good trouble in sickle cell disease. And I want you to talk us through some of the good trouble that you've been causing.
Sure. So thank you for putting it that way, because it doesn't earn me any popularity points, I think, from the general public. But, I really firmly believe, this is just my opinion, but I really firmly believe that we're not going to be able to move the needle in sickle cell disease unless we create systemic change. And, anybody who's heard me talk has heard me say before that, sickle cell is a genetic disease, it's a molecular disease, it's a cellular disease, but above all of these things, it's a systems disease. And if we don't fix the system, we're never going to be able to move the needle thoughtfully for our patients. And so that is that kind of good trouble I've been trying to get into. So in Massachusetts, we had to write the piece of legislation that is going through, because ain't nobody going to do it for us, unfortunately. So we drafted a piece of legislation 4 years ago now it's been. We have tried to move it through the state legislature over these last 4 years. Last year, we came within a hair of getting it across the finish line.
Wow.
This year, we feel very excited that we're actually going to get it all the way. And we hope that it can be a model for other states to be able to put forward their own legislation to change the landscape for our patients.
What's in the bill?
We tried to include as much as we could. So we learned a lot from some of my colleagues in Michigan and California who have put forward successfully other pieces of legislation before. So we took a lot of what they were able to get across the finish line, and then we added to it. And then we really went beyond that and sort of shot for the moon, hoping that we could get everything that we want. So there's several things. One, it creates a statewide commission that brings together patients, family members, providers, politicians, members of industry, to be able to create a report for the governor on the state of sickle cell disease every year.
Wow.
It creates a statewide registry so that we can actually know how many people are living with the disease and with sickle cell trait in the Commonwealth of Massachusetts. It creates paradigms by which our young warriors do not have to be asking for special allotments when they're in school. It builds it in so that they don't have to feel ashamed or embarrassed that they need special accommodations to be able to finish school. It creates social support services so that our patients can get access to transportation and childcare and housing support and food support if they need those things. And I think very importantly, it pays for fertility preservation so that patients who are wanting to undergo transformative therapy like allotransplant or gene therapy don't have to choose between that and starting a family.
Wow. That is quite comprehensive. Let's zoom out just a little bit. For those who might be listening that aren't super familiar with the sickle cell, sort of the composition of the sickle cell community in Boston, talk to us a little bit about what the sickle cell disease community in Boston looks like.
Yeah. I think it's an amazing group of warriors and their families who have been thriving for decades now. We think there are about 12 to 1,800 patients living with the disease in the Commonwealth of Massachusetts. As you all know, we are so far behind, we don't even know how many people actually are living with the disease in this country.
Right.
So it's a rough estimate. That those patients are spread across the entire state. And while Massachusetts is a small state, especially compared to where I grew up, the state is long. And so patients who are living on one on the western corner of the state are really separated from the care that's being provided largely in the Boston area, which is on the eastern part of the state.
So you do find sickle cell patients on the west side.
We do, actually. Absolutely. There's a good population there. And we have patients living in the middle of the state, and the commute to come see us in Boston for people even in the middle of the state is an hour and a half to 2 hours. And those living in the western part of the state can hardly ever get over. And we're lucky that I am surrounded by wonderful colleagues in the city of Boston. Our colleagues over at Boston Medical Center have been taking care of patients with sickle cell disease for, I think, 3 or 4 decades now, and really set some important paradigms that got shared across the entire country. My colleagues at Brigham and Women's have been doing this for many, many, many years. And we have our incredible children's group at Boston Children's as well. So I feel very fortunate. It's unique that I get to be sharing that space with a lot of really great experts in the disease.
Do you have good CBO partners?
Oh, our community-based organization is extraordinary. So can I plug the Mass Sickle Cell Association? Mass Sickle Cell Association is an amazing group run by this phenomenal woman, Jackie Haley, and the head of our board, Jason Kalianos, and it's an entirely volunteer-run organization, which is extraordinary. They've been doing this for 30 years. We actually just celebrated the 30th anniversary just in June of the organization. And since their inception, they've really grown enormously, to the point where now they are extending themselves out to serving those patients in Western Massachusetts and taking care of patients across the whole state.
Wow.
Have you guys developed partnerships with hospitals out on the west side of the state, or is anybody doing satellite clinics out there? Or?
Yes. So our colleagues out at Bay State, which is a large hospital in Springfield, Massachusetts, on the western part of the state, they take care of the sickle cell population out there. And they have been spinning straw into gold for many, many years. They have very few resources, but what they've done with them are pretty amazing. And the Mass Sickle Cell Association is now partnering directly with them to try to help provide them with resources. But one of the really exciting things about the bill that we were talking about earlier is that if we can get the bill across the finish line, if the bill allows the commission to sort of set a standard of care, much like we've done for hemophilia around the whole country. So if the state commission decides that the standard of care reflects what NASAC has decided as the standard of care, which is very likely what will happen, then our colleagues at Bay State can get a social worker paid for by the state of Massachusetts because we declare that that's a standard part of sickle cell care.
Wow. As it should be.
Yeah.
Yeah, absolutely. That's huge. That's huge. I mean, that's going to leave the ecosystem in such a better spot.
Yeah, our hope is that you will have equitable care, whichever hospital you go to across the entire state.
I've got to ask, this kind of rolls off your tongue very smoothly. Are you like trained in government affairs? Like, what is the deal here? Did you like minor in law?
So I have to thank my amazing speech and debate coaches when I was in high school and college. Okay. So I did competitive speech and debate for 4 years in high school, went to college on a speech and debate scholarship. Okay. My coaches taught me everything that I know.
That makes good points. Okay. Dr. C, I think we've got a natural in our hands.
Absolutely.
So tell us, let's walk into clinic.
Yeah.
Let's talk a little bit about kind of the things that have you beyond just equitable care, which is a huge undertaking. What are the sort of clinical things within sickle cell disease that are your focus, that are your passion, that are your drivers?
Yeah, I mean, I've always been very interested in systems and processes in healthcare. And so when I got the opportunity to come and build a sickle cell program from scratch at Mass General, it was really exciting for me because I've seen what comprehensive care looks like in other chronic congenital diseases before. When I was in Oregon, I was very lucky to have trained at the Hemophilia Treatment Center. We had a large cystic fibrosis center at our institution. And it was actually working with those patients that I came to really know that I really like taking care of patients with chronic congenital disease who've lived with the disease their whole life.
Yeah.
And so it's that systems and processes work that has folded in so well into the advocacy work that I've been doing. But, from a clinical standpoint, honestly, the outpatient clinic is one of my favorite places to be because you get to see patients who are thriving. We get to see our patients all the time when they're in the hospital sick, unfortunately. But it's always wonderful. And I invite the medical students and the residents and the fellows to come join us in clinic because that's where they get to see our patients living their lives. And they get to see that they are out in the world, having a job, having a family, going to school, doing all the things that they love doing.
That's definitely the best part of the job. When you
Absolutely.
see people back thriving year after year.
Yeah, absolutely. It is. I always tell my patients, like when they get pregnant, they give birth, they have to bring their babies to see me.
Of course.
Because nothing warms my heart than to see like my patients who are told forever that they can't have a family having a family. We went to one of my patients' weddings about a month ago. One of our other patients graduated, and we went to her graduation. Like it's awesome stuff that we get to do.
Yeah, it's absolutely. I mean, it's the most rewarding thing.
Yeah.
I mean, honestly, being a sickle cell doctor is probably the best kind of doctor you can be.
I wholly agree.
It's-
I completely agree.
There's nothing quite like it. You and I had not met in person for quite some time, but had crossed paths online.
Yes.
You had a pretty big Twitter presence.
Not as big as yours.
Where do people, how do people follow you on Twitter? What's your handle?
So I'm at the Sickle Doc,
At the Sickle Doc.
which is the handle my husband came up with for me. So yes.
That's a great handle.
Thank you. He thinks so too.
With people want to keep up with what you're doing in Massachusetts, if they want to keep up with what's happening at MGH, they follow you on Twitter.
Mhm.
Where else can they?
I'm also on Instagram and I'm also on Blue Sky
Okay.
on the same handles on all of them.
Okay.
Again, thanks to my husband.
So for the warriors out there, go ahead and follow at the Sickle Doc on Twitter, on X, I guess it's called now,
X.
right?
Yes.
X. Blue Sky.
Blue Sky,
That's another one. There you go. Same handle.
same handle.
Beautiful. All right. So go do that. Dr. Azar, before we let you go, I have a few things that we need to touch on.
Absolutely.
The first is we're at NASAC right now.
Mhm.
This is NASAC 2025. Has this been your first one or have you been at the ones before this?
I was at the very first one.
Tell us about your journey at NASAC.
So it is absolutely awesome to have seen this organization evolve the way that it has. I thought it was actually extraordinary that this organization came to be because being interested in systems and processes, one of the things that I'd always known that hemophilia and CF had on us was that they have these very thriving national organizations that have set standards of care, that have fundraised, that have advocated, and that have created a home for patients living with the disease. And so I thought it was really extraordinary when Julie Cantor and Sophie Landskron and my other colleagues came together to put together the first of its kind national organization. To see it grow from the very first meeting in Florida, where I think there were 40 odd centers there, to now having over 100 here. And with each of those centers bringing their social workers and their nurses and their nurse practitioners and their psychologists. It's pretty amazing to feel like we have a organization that speaks for us now, that advocates for us, that is trying to bring together resources for us, and that is setting standards of care for our patients for the first time. It was great.
You're looking forward to this meeting every year.
This is my favorite meeting of the year.
I love that.
This is my favorite meeting of the year.
I absolutely love that. I felt that energy actually here.
I'm getting there.
Yeah.
Being a beginning there. It's no, I mean, I think it's so great to, like you said, you feel like you're alone and you're doing everything anew.
Yep.
And to find 100 other centers that are muddling through and learn from each other and be able to bounce cases off of each other, and I mean, it's wonderful.
It's I think we're like the only disease group in the world that has a WhatsApp group that we all communicate on, right? And we all get to meet at these meetings to be able to not only set our own guidelines, but to sort of hear what's working and what's not working around the country for all of us. I learned the most. I come away from this meeting, I go home every year feeling really inspired and feeling like I've got friends and colleagues who I can reach out to by cell phone anytime I have a problem.
That's so beautiful.
Yeah.
That camaraderie is hard to find.
Yeah.
We're in a really cool period in sickle cell disease. It has been quite a transformative period for sickle cell disease over the last, I want to say now, really 10 years. Maybe. And I think we continue to head in towards a potentially transformative period. What's got you excited in sickle cell disease? What are you looking forward to?
I mean, the thing I'm most excited about is that we're having these conversations. I think that's what's most meaningful for the patients too. When you hear the patients talk about, I saw my face on a billboard, or I saw myself in a commercial, or I saw somebody on TV talking about sickle cell disease, that's amazing because they feel like someone actually knows what it's all about. It's fantastic to be a young physician in an era where I feel like I'm watching the foundational building blocks of my field being put in place, and to be a part of that, even in a very small way. And I feel really excited that at the point where, 20 years down the road, if we still have to take care of sickle cell disease, if it's still a disease that has not yet been cured, we're going to be in such a different place. And we're going to look back at this time as like that bygone era.
It's beautiful. It's beautifully said. Dr. Azar, well, I know we call this a Rising Stars episode. Your star is definitely, it has risen and it will continue to rise. Thank you for
Very
being
kind.
in this space. Thank you for elevating this space. It's been a tremendous pleasure and honor for me to watch you from the sideline.
Likewise.
And we are wishing you nothing but success and will continuously cheerlead you from the side.
I'm so grateful to you guys, and thank you for having these conversations. This makes a huge difference.
Thanks so much for joining us.
Dr. C, another rising star.
Amazing.
He is just a special guy. I know we're from Detroit, but sometimes I kind of feel like I'm from Boston too.
I never feel like that. But I do spend a lot of time there. And it's good to see man's best hospital has man's best champion there.
I totally agree,
working
man.
for his sickle cell patient.
I totally agree. Hey, listen, sickle cell warriors who are listening to this, if you know somebody who can benefit from hearing Dr. Azar, which I personally think is really anybody who's peripherally connected to sickle cell disease, share this episode with them. Make sure you subscribe to Cheat Codes. You can follow me at Dr. Z Sickle Cell.
And me at Imagineer.
With that, keep living your best life, and we'll catch you next time. Peace.